Hi everyone, thanks for tuning in to today's Lunch and Learn. The topic today I'm going to be discussing is sarcopenia and aging. My name is Erica Kutzbeck and I'm a doctor of physical therapy at the Gananda Walworth location. I'm a graduate of Ithaca College, go Bombers, and I've been a practicing physical therapist since 2010 and with Village Fitness since 2018. My areas of interest include sports and running related injuries, treating shoulder and knee pain, as well as resistance training throughout the lifespan. So the topic we're going to discuss is sarcopenia. You might be asking, what is sarcopenia? Sarcopenia is the progressive loss of skeletal muscle as a natural part of the aging process. So basically, as we age, our muscles tend to get weaker and also smaller, specifically our skeletal muscles. What are skeletal muscles? Skeletal muscles are any muscles that are attached to bones and primarily allow us to control different movements. The good news is physical therapists are experts in treating skeletal muscles and musculoskeletal injuries. When does sarcopenia start? Most people start to lose a modest amount of muscle mass after the age of 30, but the loss of strength increases exponentially with age. So basically, as you get older, you have a greater loss of strength over those years. What are the possible effects of sarcopenia? You may notice decreased muscle strength and mobility, a decreased activity level, so not being able to do as much activity as you used to be able to, weak bones or osteoporosis, falls or fractures, middle age weight gain, diabetes, and an overall just general frailty. So why does sarcopenia matter? Sarcopenia matters because it's present in nearly 1/2 of the US elderly population. It's also the leading cause of impaired mobility and function in older people. So basically, individuals that have sarcopenia have a dramatically higher risk of disability and an overall decreased quality of life. As you can kind of see on the graph to the right here, in early life, your muscle mass is still increasing. And then around early adult to middle age, it starts to kind of take a steep downward turn. And then if you really have a lot of loss, you kind of get into that disability threshold, which decreases your overall quality of life. So what accelerates sarcopenia? What makes it happen faster? Basically, any kind of immobility, including a sedentary lifestyle. So if you don't use it, you lose it. So disuse of muscle leads to faster muscle loss and weakness. Any kind of bed rest or immobilization after an injury or illness can also cause greater muscle loss. An unbalanced diet, so not getting enough calories or protein. Also any kind of inflammation, sometimes after an injury or illness or a chronic long-term disease can also accelerate the process. Severe stress in the body, such as chronic diseases like liver, heart, kidney disease, cancer or going through cancer treatments can also accelerate sarcopenia. So how do you tell if you have sarcopenia? Some of the signs and symptoms might be feeling a little bit weaker over time, difficulty lifting objects, noticing a slower walking speed or pace than normal, becoming exhausted more easily, and just an overall less of an interest in being active. Now, these also may be signs and symptoms of something more serious. So if you are experiencing any of these, you should contact your doctor before seeing a physical therapist. So the big question is, how do we stop, slow down, and reverse sarcopenia? The great news is that it's possible. And research shows that it's possible throughout the lifespan. One study showed you were able to reduce the effects of sarcopenia at advanced age, even up to 101, which means it's never too late and you have the ability to increase your quality of life no matter what age you are. So how do we do that? Well, the most beneficial way is using physical activity and exercise, in particular strength training and high resistance training. Both of these have shown to be extremely effective for preventing sarcopenia and reversing the effects. Other preventative measures that will contribute are aerobic exercise, so make sure you're getting enough cardio, making sure you practice good nutrition, and that you're getting enough vitamin D. The big one, however, is resistance training. So resistance training is any exercise where muscles move or contract against an external resistance. And this can include any kind of equipment: dumbbells, resistance bands, body weight, weight machines, milk jugs, paint cans, literally anything. An even better way to kind of resist the effects of sarcopenia is a high intensity resistance training. So lifting any weight you can for 6 to 8 reps before you get tired. Basically, lifting heavier weight for shorter periods of time. It's also been shown that with resistance training, the more joints involved during exercise, the better. So a good example of this would be a sit to stand or a leg press, where you're using the ankle, knee, and hip joints all at once. This has been shown to be more beneficial. A lot of times when we say high resistance training, this is where people kind of go or start to think, you know, big Olympic lifts, tons of weights, people looking like they're in pain, overall just difficult stuff we don't want to do as we age. However, high resistance training can actually look something like this. So it's functional movements, so movements that are similar to the activities that you may do during daily life, that a trained professional can help show you how to perform correctly and give you information about how to then work them into your training and exercise program. So it's very possible. It's just important that you're doing the correct exercises for you. Another research study found that individuals ages 86 to 96 who participated in an 8-week high-intensity resistance training program showed great benefits. On average, they saw a 10% increase in muscle mass, one person showing as great as 40% muscle mass improvement. More importantly, they all showed faster walking speeds, increased balance, less use of walking aids like canes or walkers. And the good news is there's no non-responders. So everyone benefited from this 8-week high-intensity resistance training program. So what is the take home? There's lots of things you can't control, especially in the world we live in today. Your strength as you age is something you are in complete control of. The benefits are clearly worth it and are shown by the research, so why not start? So how can we help? The good news is physical therapists are highly trained in developing exercise programs, specifically resistance training. So you can contact one of our physical therapists at the office to get started. We also have personal trainers on site who work with resistance training programs and setting up people with their own individual programs that would be perfect for them. You can join as a member of Village Fitness. You can sign up for an exercise class, start working out with a friend, start walking, anything to get you moving. To make an appointment, you can contact our office. There are 3 different locations. You can always give us a call with any questions you have or shoot us an email or visit our website. The other good news is that you don't need a doctor's prescription to start physical therapy. Since 2006, the New York State residents have been able to see a physical therapist directly without a physician's prescription. This is known as direct access. It's covered by most insurance companies, and you can always check with us if you have questions about limitations. And it also allows patients to be seen for 10 visits or 30 days, whichever occurs first, without a prescription. Thank you. I hope you've enjoyed this short talk. If you have any questions, please don't hesitate to contact our office or one of us to get you started. Hope you guys have a great weekend.